Hi, this is Dr. Desmond gastroenterologist. I am a strong advocate for not doing unnecessary screening tests. So I always say in a previous video that screening cancer marker for the general public is not necessary, it's not needed, and it can bring in cost and may even bring in harm. So today I have a patient admitted to the hospital for a digestive condition. So the nurse called me and said that, Dr. Wai, this patient of yours wanted to do some cancer marker test to make sure he can know cancer. So that was very strange. And when I explained to him, when I explained to him, at first I explained that actually there was no recommended cancer marker test for the general public for those with average risk. There's only 3 cancers that can be screened for the general public that are approved by almost everybody. Number 1, breast cancer by mammogram. Number 2, pap smear to screen for cervical cancer. Number 3, fecal immunochemical test or fecal occult blood for colon cancer. Beyond this, for the general public, beyond that, we do cancer screening for targeted group, for high-risk groups, such as alpha fetoprotein for hepatitis B carrier. So for this young gentleman who is only about 30 years old, he wanted to do a cancer screening marker to make sure no cancer. There's actually no such thing. But before we tell patient that, we need to find out why. So when I met him, I asked him, why do you want to test for cancer? He said, well, because my father's brother, my uncle, has some cancer. And I said, do you know what type of cancer? Is it a liver cancer? Does it have hepatitis B? Is it the lung cancer? Does it smoke? Or what kind of cancer? Then the patient said, I don't know. I just know my uncle has some cancer. I'm concerned. And since I'm admitted for digestive condition, I want to do some cancer marker to make sure I can know cancer. And then I spent the next several minutes explaining to him that number 1, cancer marker for the general public is not accurate. In other words, even when the cancer marker is normal, it does not necessarily mean that there's no cancer. And number 2, more importantly, even if the cancer marker is elevated, for the general public with no risk factor, almost always they do not have a cancer. So it means that if you have a cancer marker of CEA or C125 or IVFP that are elevated from a health screening, the chance of you getting cancer is extremely low unless there's a risk factor for liver cancer, such as hepatitis B for liver cancer, or you have a family member having colon cancer for colon cancer. So after a much explanation, he's convinced by me that the cancer marker will not exclude him from having cancer. It is futile to do a cancer marker for a patient with no risk factor for cancer just to make sure that he has no cancer. There's no such thing actually. So I'm pleased that he accepted my proposal, and he said, okay, in that case, since Dr. Wai, since you think that it is not necessary and maybe potentially harmful and cost me a lot of money, I don't want to do the cancer test. This is correct. So in summary, there's actually no recommended cancer marker for the general public. But if you do have a risk factor for cancer, either because you smoke for lung cancer, or you have family member having colon cancer, or you have history of a colon polyp before look for colon cancer, you have a family member having breast cancer, then yes, maybe there's some targeted cancer screening for you. Otherwise, there's actually no cancer marker that are recommended for the general public. They can bring harm in terms of cost and worry and unnecessary extra tests, okay? So before you do a cancer screening, do talk to your family doctor. In Singapore, we have a Healthier SG, and a group of family doctors that have to follow certain evidence-based protocol. Talk to your doctor, talk to your GP, enroll in a Healthier SG, and they will send you to do the appropriate cancer screening. This is Dr. Desmond, gastroenterologist.